Today we will discuss briefly about voiding dysfunction in children. Now, voiding dysfunction is also called as bladder bowel dysfunction or BBD, or in adults usually it's called as LUTS. Now, we are seeing an increasing incidence of these voiding dysfunction or dysfunctional voiding in children with the progression of time. This is probably related to the changing food habits, changing school and school timings, and in general the changing habits of the society. So typical children with voiding dysfunction are school going children, especially girls are more prone for this. So this is basically a behavioral problem or a problem of bad habit, you can say. So these children tend to go to school by school bus. Usually the school may be far away, so they typically do not have time to empty their bowel in the morning, and then they go to the school. The toilets in the school may not be very clean, so they don't drink water. Even if they drink water, they don't want to go to the toilet and pass urine. So basically what happens is these children have a combination of holding urine for long periods of time and constipation. When this happens, the bladder starts misbehaving after certain, because the bladder gives you a sensation. It gives you an alarm. Once it is full, it wants to empty. Now, if you don't empty it on time, and if there is constipation and the rectum is always full of stool and pressing on the bladder from behind, bladder gets irritated. So in simple words, the bladder becomes a rowdy bladder and starts misbehaving. So these children present with various symptoms, like the minor symptoms like wetting in between the voidings, the wetting of the undergarments, urinary tract infections, then of course constipation, and sometimes they may have soiling of the undergarment with stool also, then bedwetting. So when the treatment is usually behavioral treatment, it's called urotherapy. Some tests are necessary to confirm the diagnosis and rule out other possibilities. But the basic thing is that it's a behavioral problem. Prevention is better than cure. If your child has any problems like this, better to see a specialist in your neighborhood. Thank you.